There's a little girl that I remember was 7. She had cerebral palsy, and mom had difficulty cleaning her teeth just because of positioning and her oral musculature. And all we did was, we went in, cleaned her teeth, took x-rays, and the parents were so happy and so appreciative because the child smiled all the time. You talked to her and she just like beamed and lit up. So.
I had been around people with disabilities all my life. My youngest brother is disabled. So all through college I worked for United Cerebral Palsy and in a group home, and in the summer times I was a camp counselor at Camp Easter Seal in Somerset, Pennsylvania, where I'm from. So I just had a natural interest when I came to the university to do what I could for people with disabilities.
I can't give you a percentage because it depends on the clinician's skill and their knowledge and their comfort level with treating patients. I personally think, unless there's some medical condition that's prohibiting them or from safely being treated in an office, they can all be treated in a dentist's office.
In a standard office, at least 80% of the population of, I think, folks with disabilities could be easily seen, and without any special needs or anything to do that. You don't need machines, monitors, or anything. They're just people and teeth.
I think that people need to get more involved with treating patients with special needs, and I think just awareness and familiarity with patients, their needs, the equipment that they have. I think fear of the unknown is what keeps us from doing some of the things.
We just try and take care of them, do the things we can to make their dental health better, and it just works out for them in the end because I know we do a good service for them.
We have a willingness to work to try and do what we can.
You always hear people say, oh, I don't like going to the dentist and everything, and there can be times when it's not a very rewarding thing to do, but for me, treating people with disabilities is very rewarding because I'm doing something that many people say can't be done.
She's 38 years old and she's a Down syndrome patient, and I've seen her for a little more than 6 months, but we have done a lot within this 6 months. She came in with multiple carious lesions. They were all broken down, and she had not received any dental care at all for most of her adult life.
I think we just need to be more involved, ask more questions, and just do it. It's that simple, I think.
We got her in, we had to essentially build most of her teeth up, and now it's come to a stage where she actually looks forward to come in here, and she's so affectionate like most of them are, and it's things like that makes it rewarding and worth the effort.
Sometimes, again, that's the only thing you can do is maybe brighten their smile, straighten, crooked filling or something like that, or replace a filling. They're the little things that make a big difference in their lives.
Like I tell my students, I said, this is your chance to try to do what's right for your patient and do the best you can.
Students, I think them having the experience too is helpful. And I think, as Dr. Geary said, they can't say, I never, experienced that. So give it a try. That's all we want them to know, is that it's possible.